Hi, welcome everyone. This is a session of the National Academies of Science, Engineering, and Medicine and the Population Health Roundtable. And our focus in this session is on public health. We're going to be talking about where we are in public health and where we're going. And we have a terrific panel of people that will be talking about this. And in just a minute, I will turn things over to them so that they can introduce themselves. But I want to mention a few things just to welcome you to this session. The first thing I would say is we want this to be a conversation. So this won't be a formal panel where you'll be hearing individual speeches one by one. Instead, you're going to hear a conversation from just some of the most skilled and knowledgeable people in public health. But we want you to be part of that discussion as well. So we'll be asking you to send us questions throughout the session, and then we'll be spending a fair amount of time using the questions that you're sending. So please, at any point in the session, just send a question via the chat function, and we will be asking our panelists to talk about those. I'd also like to say that if you would like to tweet, the hashtag is PopHealthRT, and we encourage you to do that. We'd like people to be part of this discussion who aren't able to participate today by listening in. So please tweet at the hashtag PopHealthRT. Finally, I'd like to start by saying a key public health issue has to do with voting and participating in civic activity. And today, it turns out, is National Voters Registration Day. So for all of you that are listening, please pay attention to that. Please take care of voter registration for yourself, for your friends, for the communities you work in. It's extremely important that we work on this. There's a public health-oriented section of activities on this that is under the name Vote Safe Public Health. You can Google that and find out more information by doing so. So now let's turn to the people who are on the panel. And I'm going to ask each of them to introduce themselves. And in introducing yourselves, don't go through your whole biography, but just tell us what you've done in public health, what kinds of jobs you've had in public health, because I think that will be helpful for people who are listening in as you're drawing on your own experiences. And in addition to that, as a way of introducing yourselves, tell us a little about yourself, and in particular, tell us how you have managed to stay grounded during these very difficult times. So I'll start to show you what I'm talking about. I'm John Auerbach, and I now work at Trust for America's Health, but I was a local health officer in Boston for many years. I then was the Commissioner of Health for Massachusetts, and after that I worked at the Centers for Disease Control, overseeing the policy office. And I would say the way I've kept grounded has been walking through the woods. I live in an urban setting in an apartment building, but behind our building there's woods in Washington, D.C. where I am. And once a day, being able to get away from Zoom calls and emails, it's been great to walk through the woods. So maybe, Monica, I'll turn things over to you.
Sure. Thanks, John, and good afternoon, everyone. My name is Monica Valdes Lupi. I'm going to follow John's lead. So I'm currently week 2, Managing Director of the Health Programs at the Kresge Foundation. Prior to Kresge, this is going to sound actually similar to John. I most recently had served as the local health officer for the city of Boston, have state public health experience serving as a deputy under John in Massachusetts, and national experience with the Association for State and Territorial Health officials. I spent the majority of this year also working as a senior fellow at the de Beaumont Foundation and supporting our Big Cities Health Coalition, and also had a chance to work as a senior advisor with the CDC Foundation, all things COVID this year. Thanks for the opportunity to join the panel.
And what's kept you grounded?
Oh, right. kept me grounded. So Filipina, I'm Filipino American. My husband's Italian American. So as you can imagine, we've been doing a lot of comfort cooking with our children. So that has helped us stay grounded and just keep things simple, as complicated as everything around us is these days.
Great, thanks. That's yours.
Oxiris Barbot, and I am currently Senior Fellow for Public Health and Social Justice at the JPB Foundation. I actually am also week 2. Prior to that, I've been in local public health for the last 17 years, most recently as Health Commissioner for New York City. Prior to that was Health Commissioner for Baltimore City. And then I've also been Medical Director for the New York City Public School System. So I am a native New Yorker, and what keeps me grounded, in addition to being outdoors, is meditating every day. So throughout this pandemic, I meditated anywhere from 20 to 30 minutes on a daily basis. And that kept me grounded, and I'd like to think it kept those around me grounded as well.
Great. Thanks so much. Umair.
Thank you, John. First of all, thanks for hosting this and for having me on. And I just want to just be excited to be a part of this panel with such great colleagues. My name is Umair Shah. I'm the Executive Director at Harris County Public Health. I'm also the local health authority in Harris County, Texas, third largest county in the U.S. And I've also been an emergency department physician at the Michael E. DeBakey VA Medical Center for actually 20 years. I look a lot younger. Maybe I don't look that young actually than I look. But it's really just the interface and intersection of public health and healthcare that continue to drive me. I'm originally from Cincinnati, and prior to that, Pakistan, and that's actually part of what has kept me grounded during this whole very overwhelming experience. Gardening with my wife, we have peppers and gosh knows what in the backyard that we've grown, and we have 3 kids, and we've been now watching Pakistani South Asian dramas, and we actually have these lately. We didn't have it before, but these Friday night where it's 4 hours of just dramas, and kids know more about these actors and actresses than I do, but I will tell you, it's quite, if you've never watched it, I really do recommend them. So that's what keeps me grounded right now.
Thanks. Joneigh.
So good afternoon. Really excited to join this panel today with many people who I consider friends. So I'm the Chief Medical Executive for the state of Michigan, which means I'm essentially the top public health advisor for the governor of Michigan. But I also serve as the Chief Deputy Director for Health in the Michigan Department of Health and Human Services. So public health, Medicaid, aging, and behavioral health are all under my kind of umbrella in the Department of Health and Human Services. I'm also, like Umair, a practicing emergency medicine physician. So I practice at Henry Ford Hospital in Detroit. Going back, before this role, I was the Detroit Health Director. Before that, I was the Chief Medical Officer in the Baltimore City Health Department. And then before that, I also spent a little time in the federal HHS Office of Health Reform as a fellow implementing the Affordable Care Act. What do I do to keep me grounded? So I also have 3 children, and we go on a lot of bike rides. I have not ridden my bike as much over the past 6 months since I was, in middle school. So it has been fun. I got a new bike, and it's been keeping me grounded and hopefully a little healthy during all of this.
That's great. Thank you. And Jose.
Good afternoon. Jose Montero. I am a family physician by training, an epidemiologist, have a master's in healthcare delivery science as well. For the last 4 years, I have been the director of the Center for State, Tribal, Local, and Territorial Support at the CDC, the Centers for Disease Control and Prevention. And I am currently deployed as part of our own internal response as one of the deputy incident managers for the CDC emergency response for COVID-19. Before coming here, I spent maybe 15 years or more than that in New Hampshire, where I was chief of infectious diseases, a state epidemiologist, a state health official. And when I left the state service, I worked as a vice president of population health in one of the hospitals in the Dartmouth system, the Cheshire Medical Center in Keene. As you may imagine with this accent, I am not from the neighborhood. I am from Colombia, where I used to work in a similar approach. I worked public health. I was a faculty in the preventive medicine department, and I worked for the Ministry of Health as director of population health as well. So a mixed career of academic background and practice.
What keeps you grounded?
What keeps me grounded? I try to read a lot, anything that has nothing to do with what I do for a living. I walk, and I sit down to have every meal that I can with my family when I am in the same city as them. And we play games, table games, card games, Rummy Cubes, Unos, whatever, you name it, for hours. So they help me keep my mind out of this and allows me to refresh myself.
Well, thank you. Well, first, two observations. One is what a remarkable group of people, and how lucky we are that we'll be having you have this conversation that we're going to have. And the second is, if we didn't talk about anything else, I think the examples people gave of what you can do to survive a pandemic and keep your sanity are great examples of the range of different activities. So thank you for sharing those. Well, speaking of the COVID, as we start this discussion, everything I would say in public health in the last 6 months has tended to really focus around two major issues that face us. One is the issue of grappling with this pandemic, and the other is fighting for racial justice and equity. And so I think it makes sense for us to start there as we talk about where we are in public health and where we're going. So let's start with COVID. In terms of COVID, where do you think we are in the sector? There's been a lot of criticism of public health. There's also been a lot of praise for public health. Public health folks have certainly been on the front lines. How's public health doing now? And again, this is a conversation. So I would say keep your comments relatively short so that we can kind of have cross conversation and hear from more than one person. Who'd like to start?
I can jump in.
Please.
I think I'll just say generally, I'm incredibly proud to be a public health professional and leader right now. Many folks don't know this, but a lot of folks in public health, we didn't just start working on this pandemic in March. At least that's when Michigan started having, identifying our first positive cases. We were working on this in January. There are some people in the health department who have not had a day off since January. And they, day in, day out, weekends, nighttime, you call them right now and they are right there. They are committed. They are serving. And it's just, I think I'm just very proud, full of pride right now when it comes to public health.
Thanks.
John,
Please.
I'll jump in to say that I think, we have to acknowledge that it's a mixed time for public health. I think we have to acknowledge that the disconnect between local, state, and federal aspects of the response have been a challenge for public health. But as Joneigh, rightly points out, I think it's an opportunity for us in public health to really have an opportunity to show off our staff, right? Because for way too long, public health's work has been done in the background. And it's now, I always talk about this as our Super Bowl, and to really demonstrate the bench that we have. And I think that it's never been a better time to be in public health. It's certainly not easy, but it's an opportunity for us to distinguish ourselves from the healthcare delivery system, and that public health is not about delivering healthcare to individuals. It's about a lot of things, including helping our cities, our country survive a pandemic. So while it's a mixed time, I'm really optimistic about the future of public health and where we will come out as a field at the end of this.
John?
I was just going to jump in and, say that just to add to what Oxiris and Joneigh said, I am so proud to be on this panel and to have so many colleagues who are so committed to the work. And I also agree that even while we're in this crisis, I have heard so many amazing stories about public health at multiple levels. So local, small, medium, big city, up to the state level and our federal partners, but really focused on the locals that they've created or at least built on partnerships that they had prior to the pandemic. So hearing stories at the local level about public health-led call centers with other city departments because of the challenges that they've been facing with budget reductions and furloughs. Sometimes these sorts of crises make for interesting bedfellows, I think. And so I'm an optimist, and I agree that it's a great time to be working in public health despite many of the challenges that we're facing. And I don't know, if, Jose, if you're gonna talk to like trust issues, I think is a challenge, right? So despite workforce shortages, I think that there are other challenges that perhaps Jose is going to comment on.
Yeah, thank you, Monica. Several different things, but it is impossible not to be proud to be part of the public health community today. As much as many people say you didn't do this or you didn't do this right or you want to do that, the reality is that in the face of an evolving science and the biggest crisis of our times, the capacity for the system to respond has been amazing. It has not been perfect. I wouldn't expect anything to be perfect ever because everything is based on evolving science. And that is actually maybe one of the biggest challenges that we face as a sector. For many years, public health has highlighted the point that we are invisible or that people don't realize what public health is. Now everybody does. I only hope that as society look at public health, they realize what we have and what we don't, what we can achieve with what we have versus what they would expect us to achieve, and why maybe some other things need to be developed, engaged, or improved as we move forward down the road. We didn't start preparing for a pandemic response today. We have been doing this for years. I remember when I was a state health official developing the flu pandemic plans, and it's basically the same the same footprint that we are using for today's response, knowing that it's different, knowing that the virus is different. But at the same time that I am incredibly proud of what we have done, it has highlighted many of the things that we need to improve. How do we look at data? The timeliness of our data, the type of coordination that we have. We need to become more agile, more flexible, way better integrated than what we are, not just internally as a public health system, but with the healthcare delivery system and with all of the network of social services that are required for people to be able to face a situation that maybe we haven't faced in more than 100 years. So I think that we can elaborate a lot more on that part and that last part of coordination across different sectors, because the pandemic has highlighted who is more vulnerable to illness in this country. The pandemic clearly showed us who is dying. The pandemic clearly is showing where they are dying. It's not that we didn't necessarily expect that to happen, but the data is so in front of us as a society that it has to force us to act upon it and change many of the things that we do and have nowadays.
Great.
Yeah, And John, I would just, sorry, just to add in is that I think it's really been, it's been, when they say every challenge is an opportunity, the yin and yang. I mean, there are so many fantastic things that have occurred, so many challenges that have also occurred. Unfortunately, I think the politicized nature, at least in this nation, is, especially in this nation, obviously it's happening across the globe, is a significant issue that it has brought to light. I've always said the hashtag invisibility crisis that public health is really a part of, and really fighting that is those three. I think a couple of you have heard me say this: the 3 V's of raising the visibility. When you raise visibility, there's value. When there's value, there's validation. Pro-health policies, pro-health resources. We never thought it would be the 4th V of virus that would actually raise the profile of public health, and not all of public health has risen to that level, has risen up to be, in an honest way, has been able to respond in that manner, and yet the vast majority of public health has. But even where it hasn't, the question is it because public health has not done it, or is it because there have been impediments or constraints or restrictions that have been put upon it as a field? And that's a real challenge. And so while I'm hopeful, as my colleagues are, that when we get past this, we'll have a true look at the value proposition of public health, I'm also equally concerned that the narrative will be painted in a way that people will forget what's occurred, and or will have a different way of describing those details. So those are the concerns that I have, but also I think it's an incredible time for public health. And I would really, again, continue to recommend it for young professionals. But I do think people have to have their eyes wide open, because we've learned a lot as a field during the last several months.
Well, so maybe that's the next question I would ask. There are some people who would say, we're at a critical moment, a sentinel moment in public health. And some of you are optimistic that this is a point where the public sees more about public health, and that may be an opportunity for us to gain more support. Others are concerned that this, since public health hasn't had the resources, there have been stumbles at times, that folks will have less faith in public health. So I guess I would say, as you're looking at this and you're thinking about what are the lessons, is there a lesson or a recommendation you would make that at this juncture would move us more towards that positive outcome than one that could be less than positive? And any thoughts about that? What do we need? What have you learned that's going to be useful in terms of moving ahead in a positive way?
So, John, I think just to start us off, for me, I think the biggest lesson learned has been actually 2, but I'll start with the biggest one has been the value of risk communication. Never in the modern history of public health has risk communication been so critical. And I think that one of the things that really helped us in New York City was really early, frequent, clear, consistent communication to New Yorkers, even when we didn't know something, but being open about what we didn't know, being open about what was changing. That, I think, did a lot to garner the trust of New Yorkers when it was most critical, and to have those messages be reinforced by leaders across different sectors, not just public health, but elected officials, leaders in education, et cetera, et cetera. And so I think that as we go to what I think many of us think is an inevitable second wave, having consistency of that messaging is an opportunity for us to have a restart in this pandemic. And I think that then gives us an opportunity to let public health shine. The other thing I'll say in terms of, I don't know if this is a lesson learned or areas that I'm concerned about, but it kind of touches on a little bit on what Umair said, I'm concerned about young people considering public health as a career, given all of the ways in which public health leaders have been targeted and been scapegoated. I don't want young people to come away thinking that, I don't want to deal with that hassle, because really the value of public service and the value of bringing science to bear in the everyday lives of Americans is something that is so precious and valuable that we have in public health in our country, that I want to make sure that we do everything we can as a sector and as a country to protect that.
If I can just build on what Oxiris said, I think communication has been incredibly important. But I'd add, not only with the general public, but I think it's also really important that public health professionals, epidemiologists, scientists know how to communicate effectively with leaders who don't have that scientific background. I think that's been incredibly important. In my previous roles, I know we've got experts on the panel here, but being able to distill scientific information in a way that speaks to what folks who have to think about other things care about, I think is incredibly important. And I think that, quite frankly, when we think about public health education and how we're bringing along that next generation of leaders, we need to make sure we're teaching the next generation about how to communicate effectively, not just with the public, but with political leaders.
I do agree with that. We need to be able to better communicate uncertainty. Sometimes we think that we need to tell the public that we know everything and that we know it all up front or even before it happened. That's not the reality. That is not the way that science evolves. And we have a new disease of which we didn't know much before it started. Being able to communicate that uncertainty is a skill that actually we may need to improve at all levels, for us out, for us up, for us down, for us across, because we need to be able to do that. But tied to that lesson learned on communication, better data and more timely data collection, transmission, and presentation to the public so they understand really what is happening. It is incredibly important. And that may have not necessarily been a place where we have been, where we needed to be from the very beginning. People today is used to, oh, this is my cell phone. I look at it and I have all the answers, and I get the map from my street and I need to know what's happening there. And we don't do that in public health in many cases because we can't, because we are not going to be disclosing all of the information about who is sick and where, because we want to protect people's privacy. And that's another dichotomy that has been quite interesting messaging to the public, because they want to know where people are sick, but many of them don't want to tell us when they are sick or who they were with when we're asking them to do contact tracing. So again, all of this is an amazing and interesting challenge in what to communicate, when to communicate, and how to communicate. How do we pass the science, the data, and the behavioral science that underpins everything that we do, so we can get a more effective strategy that allows us to really educate our society, and we all together do what is right for us as a society, not just for me as an individual.
I think to jump on to what with the communication piece, and the risk communication is also the communication and leveraging of community partners. So just add another C in terms of community engagement, particularly as we're trying to convey complicated issues to the general public. And so what I have valued, or I guess what I've observed from lessons across the country and what's been working, is really making sure that you are working with your trusted community partners to be extenders and to be messengers and allies for the public health departments. And I know that we're going to be talking about racial justice and equity as the conversation goes on, John, but I don't think we can minimize the importance of community engagement as part of the larger communication process. And I think as we think about what's going to come with a vaccine one day, we're going to have to lean on those community partners. And that's what I'm hearing in some of the discussions with some of our health departments. We're fortunate to be in Massachusetts and in Boston, where we have traditionally very high vaccination rates across the board. But in those other jurisdictions and municipalities where there's already an erosion of trust and already lower uptake on the flu vaccine, for example, how are we going to engage our community partners to help us continually prepare for this next stage and this next phase?
Yeah, and I think the last few comments just remind me of the incredible importance of the skill sets that we as public health need to have, which we may have thought we had, and not all of us have, unfortunately. And the reality is that what Jose has said, Monica said, Oxiris and Joneigh, is that really it's all of us have to be better at, and not just the 5 of us necessarily 6, but as a field we have to be better at understanding and recognizing the real drivers of decision making in communities, and also recognizing that there is a health authority role as well, which I think a lot of folks, while they thought public health was invisible, it may not have been just like taking a ticket at a ticket counter and you were just a transactional activity. I think a lot of folks in our communities have been really shocked that public health has a health authority role, has the ability actually to make recommendations and or actually to, from an authority standpoint, to close things down. And that is a legal statutory aspect of public health that people don't recognize and have not recognized. And that, I think, is really upon us to really educate and engage, but also to use that very wisely, that it's not about doing that because we're trying to shut, quote unquote, society down, but because it's a solution for how society can move forward in the midst of an overwhelming and what I call squirrely virus, like super slick squirrely virus, like COVID-19. And so I think that these skill sets that you've heard about communications and engagement and being good at social media and recognizing the ability to articulate concepts that are very difficult in uncertain times, but be able to do that in a way that's actually not going to be scary and not going to cause fear is a huge aspect of our work. And I think a lot of times when practitioners, whether they're physicians or attorneys or DRPHs, doctors in public health, or epidemiologists, when we communicate, we want to communicate from a very siloed scientific aspect when we really need to be thinking about being really part of the community and helping a community just as you would help a patient through a very difficult time in a disease process. But the community is our patient in this case. And how do we do that in the midst of a horrific pandemic that we've all been facing?
Thanks for thinking about those lessons. I'd say, many people would say, a key lesson that has come out of COVID-19 is the importance of improving and increasing the work that we're doing around the disproportionate burden of illness, injury, and death in populations of color, and that we need to work on issues related to promoting equity. And there are 2 questions that have come in from people who are participating and listening to our conversation, and I'm going to give you both of those questions because they're related to this issue, and maybe ask you to comment on this. The first one says, how are we going to influence public health, particularly governmental public health, to prioritize Black and Latinx, and I think other populations of color also meant by the person who submitted this, who are disproportionately represented among those who are most affected by COVID. And then a follow-up from another person said, how do we do that, namely deal with COVID and the impact there, but also think about the underlying issues related to injustice in general. And the person asks about things like living wages and expanding Medicaid coverage and affordable quality housing. So I guess I'll throw that out. How do we think about ensuring that we're addressing the populations at disproportionate impact, people of color during COVID, and also think about some of these underlying issues that are related to systemic and structural racism and multi-generational discrimination? That's a couple of big questions from the listeners. So anybody want to jump in there?
John, let me go first. What I would say is that, COVID did not start these inequities. If anything, the pre-existing inequities, unfortunately, have been accentuated and worsened by COVID-19, not just the disease, who it's been impacting, how it's been impacting disproportionate communities in our larger community, as well as because of the decisions and the actions that we've had to take as response agencies, if you will, to be able to curtail or suppress or respond to the pandemic. So I think all of that together, but it's just accentuated those pre-existing inequities, the injustices, the fact that we have social and structural aspects of what we call determinants of health, but we forget they actually determine health. That's the word, determinants of health. They determine health. And I just really, I worry that oftentimes, especially on the political landscape, folks have forgotten the fact that these are pre-existing that have gotten, yes, markedly worse during the pandemic. We have a responsibility, just as we had prior to the pandemic, to address those. And unfortunately, in many communities and as a nation as a whole, we have not addressed those, whether we've chosen not to or we were unable to. But that then plays into what's the road ahead when we have larger communities, and in our Harris County community, Hispanic, Latino communities with especially younger generation of individuals who we're trying to reach. We're going to flea markets and doing all sorts of things in social media and campaigns and activities. And yet we're recognizing that it's not the same kinds of strategies as it is for the entire community. So we ourselves in public health also have to reflect our community. We have to be diverse like our community, and we also have to share those values, and we have to articulate the importance of it, but then make sure that those actions follow what we really truly believe truly is about what public health has a role in addressing these pre-existing conditions that unfortunately have just gotten markedly worse during this COVID-19 pandemic response.
Maybe I'll build on that. I 100% agree with Umair. I think we really have to be intentional in public health. One, people need to vote. We need to get diversity, not just in our public health departments, but in all sectors of leadership in our communities. We have to be intentional when it comes to the decisions that we make in the health department. So one thing we're doing at Michigan, we have an equity impact assessment tool that we're actually going to be implementing. So every decision that's made, how is it impacting communities of color? How are you engaging communities of color? Even looking at your hiring practices. One thing, again, even before COVID, when you look at any public health issue, my team knows, don't show me anything unless you've looked at it and broken it down by race and ethnicity. and oftentimes you'll find that these disparities exist. So I think we just have to make it intentional. We have to be systematic in how we make decisions so that when the next people come along, it's just the way we do our business. It's the way we do our work. It's not someone has to come along and make a new task force or do something. It's already part of how we do our business in public health.
I'll add to what Joneigh and Umair have said and use the example here in New York City about how we applied a racial equity lens to really change the character of the response. And it ties back to something that Jose said earlier in terms of the importance of data. And I couldn't agree more that we need better data to do our public health work. But we can't be prisoners to imperfect data. So one of the things that we did early on was in looking at the data that was coming in, we're seeing that Black and Brown New Yorkers were dying at twice the rate of white New Yorkers. And even though we had at least half of the data be incomplete we still sounded the alarm because the inequities were so glaring. And so I think to add to the conversation, what we need more in public health is courageous leaders, right? And in addition to having leaders that are representative of all of the communities that we're serving, it's to have courageous leaders who are able to make hard decisions in light of imperfect data, which I think is by definition public health practice, right? We can't wait for the perfect. And I think in order to have more courageous leaders in public health, we need a civil society that supports the value of public health, and have a workforce, again, that is trained in applying different approaches to what we're seeing. The other thing that I will say is that in terms of addressing racial inequities that we're seeing in this pandemic, I think, it's incumbent on us to use the data that we collect in different ways, right? For me, it's not about collecting more data, because we're never going to have perfect data. It's about using the data that we have to create that arc of a narrative that's going to help to change the way in which resources are allocated to address the underlying drivers of persistent inequities that have grown over generations. Umair said it, and we've all been saying it, these inequities didn't happen overnight. They're not going to get fixed overnight. But certainly I think that public health has a role in using our existing data to pivot to a new narrative moving forward, and one that looks at supporting communities and looking at how we address housing insecurity, food insecurity, to make it easy for people to comply with isolation, quarantine, and not be put in a position of being policed because of a pandemic.
I strongly agree with that. And a key factor here is intentionality. We need to intentionally talk about this. We need to intentionally look for the data. We need to intentionally act based on what we are seeing, but don't wait for the perfect data, because sometimes that seems more as an excuse that we have, and where we are waiting to see what happened and then somebody else will do it. Of course, public health is not going to solve education or employment completely, but we add a lot of value to those sectors, and we need to be able to highlight, to show what we bring to the table, at the same time that we show the impact of not acting. Through immunizations, we make sure that kids are healthy and able to attend schools. So we need to show that, because then they can get the education that they need. When we do the measures of risk factors at the workplace, we are trying to make sure that everybody has access to a healthy workplace. So there are many places where we connect. We cannot look at our programs and our activities, traditional, historical public health activities, as isolated. We need to see them in the context of the society and the community where life happens. We see COVID-19, who has been carrying the bulk of illness disproportionately. And that has to do maybe with housing. That has to do with the type of employment that these populations have. This may have to do with many other of those limitations. Maybe we from the public health sector are not going to change them, but with our place at those tables where those discussions happen, it's our duty to raise them and to show and to measure and to assess the impact of policies that will tell us what works, what doesn't. And I think that that is a perfect role for any public health agency around the country.
The only other thing I would add to what others have already said, because we've talked about or highlighted the importance of data in terms of program design and implementation and the different response activities, is also the importance of data on policy decisions. And so policy and advocacy have been so important during this time to lift up the impact of COVID on our communities of color and how disproportionately they've been impacted by unemployment and evictions And so, these progressive policies around paid leave benefits, living wages, and making sure that people are in stable housing, this has provided us with an opportunity as public health leaders to also advocate and to partners with others who can help us really address these complicated issues, John, that we're here and they're actually, from now I'm wearing my philanthropy hat, and we've been in discussions about how this is going to impact multiple generations in terms of morbidity and trauma on already traumatized communities, particularly our Black and Latinx and Indigenous population.
John, can I get a reprieve here? It's because Monica mentioned something that's incredibly important, and we sometimes think about today. Adverse childhood events are clearly at the base of many of the things that communities that are suffering have. So when we're looking at how we are going to solve this toward the future, addressing better conditions for children today is going to have a dramatic impact as we look at prevention from down the road. And we know that those adverse childhood events may impact some communities more disproportionately than others. So that is a perfect place to look at what we are doing today for the future versus what we're doing today for the disease of the day. And we cannot just go for the crisis of the day. We need to change. And from public health, we can play a huge role addressing those because it will help us prevent chronic diseases, injury, violence, and many other things. So we need to look at what we are doing for children toward the future. Thanks.
Well, we're getting lots of questions from listeners, and so we're going to take those in just a few minutes. But before we move off of the discussion around the issues of combating racism and promoting equity, and related to that, as you've all indicated, there are all these other issues as well. What we do internally, how we collect data, how we think about working upstream. I guess I would share that my own experience has been there around these issues. There have often been in public health a desire to work on the issues, but a frustration that funding doesn't come in a way that necessarily allows us to tackle these issues in an optimal way. We can be in our own silo rather than having influence with other sectors. And if we're getting categorical funding, that makes it hard to sometimes work outside of the disease model. Or that tackling issues of racism are controversial issues, and that they are sometimes difficult for elected officials to be grappling with. So I'm going to present a scenario to you. I'm going to imagine you're all in a state where a new governor was just elected, and the governor comes in and says, basically, I have a clean slate with regard to what I can do. I will do whatever you tell me to do in terms of improving health and dealing with some of these issues. What are the policies I should be putting into place that relate to improving health, but with an understanding that racial discrimination and social issues, social and economic issues are major? Tell me what I should do. Joneigh, you work for a governor, but let's have a hypothetical governor. A brand new governor from another state calls you up and says, tell me what I should do. You've had the experience as a state health official. Anything you say, I'll do. What should it be?
Well, I think that may be actually what actually happened. I am very lucky to have an amazing governor. And what I did tell her actually early on was, I think we need to focus on families and we need to focus on children. And that's why, our governor, I know this is hypothetical, but we are building out. COVID's kind of thrown it a little bit off track, but we're building out our initiatives on maternal and child health, proposing expanding Medicaid, still working through how we can fund that. But I think families and children, to what Jose said earlier, that's the future, and that's what we have to focus on. And I think also, again, those social determinants of health. We we've been building out a social determinants of health strategy in MDHHS. And it's been nice kind of bringing together housing, SNAP. Can we do cross enrollment, for example? So folks who are eligible for WIC, can we also make sure they're getting their food stamps and other social services, and integrating our technology systems as well. So those are some of the things we're working on in Michigan.
Great. The rest of you have just been called by the governor to say, tell me what to do.
I'll build on what Joneigh said, and just to echo something that she had said earlier in terms of using, I think it was Joneigh, a health impact approach to policies that are being considered so that you get the multi-sector influence on health outcomes. But beyond that, what I would say is, as a way of measuring the impact that all of these potential policies have, is to really focus on premature mortality. Because when we look at the way in which inequities play out, it's the fact that Black and Brown and Indigenous Americans die much earlier. They die before their time from things that kill all Americans, that kill all humans. But the fact that they die before their time is where, from my perspective, the injustice lies, and where the greatest difference can be made in the shortest amount of time. And that's really, I think, from an elected official's point of view, where we get value from the dollars that we invest, and not playing into the notion that we need to have outcomes in a year or two, because we need to reject that notion that if you can't get outcomes in a year or two, it's not worth doing. Because I think certainly what COVID is exposing is that these are issues that are going to affect us for the long term, and that we need to take a long-term investment approach to the way in which we address racial inequities in this country. But at the same time, I think we need to have rigorous metrics in place. And from my perspective, looking at premature mortality is that most sensitive indicator, acknowledging that, in the pediatric population, me being a pediatrician by training, certainly we look at infant mortality as the most sensitive indicator of how well a society is taking care of its most vulnerable.
I guess I would, to add something a little bit different, but I think Joneigh might have read this about the work you're leading in Michigan for your governor, the importance of training. I was able to come into or return to the Boston Public Health Commission to a requirement that every new employee who began at the health department had to go through a mandatory 2-day training on anti-racism efforts, and then also how does this all apply to their programmatic work. And so I think training and making sure that the public health workforce is aware of their power and the ability that they really play in making lives better for the communities that they serve is important. And the next phase of that work we were doing at the health department was taking that training and training our other city departments. So the mayor convenes a health equity task force across the city departments. And so we were able to support other city departments in recognizing, and people knew because Mayor Walsh is very committed to racial justice and racial equity. So making sure that we're all singing from the same sheet of music and that we're being trained is important. The second piece that I would add, and people have alluded to this, is how do you then operationalize it? So it's not just words, but you're putting your words into action. And again, this was something that we started last summer with an equitable procurement policy to ensure that, the hundreds of millions of dollars that the health department was contracting out to vendors were going to Black, minority-owned, veterans, women's-owned businesses in the city. And so I'm really proud that, the health department had some of the highest percentage of our contracts going back into the community, investing in neighborhoods and minority-owned businesses. And so So I think that might not be the sexy aspect of public health in terms of the administration and finance side, but they're also critical in rounding out the work of the public health workforce. So it's not just relegated to, one program dealing with infant mortality or violence prevention or youth development. So I think those are important.
A couple of things that I would add to what our colleagues here have presented, and looking at this from the practicality perspective. So if I have a clean slate with a new governor, I will approach a plan that shows 4-year and 8-year goals, looking at what the epidemiology of that particular state is. Every state is different, and the realities of geography need to be accounted for, because maybe the impact of climate, the impact of industry, the impact of urbanicity cannot be discounted. I have never been a believer in one recipe fits all. So I need to look at the context, and then I will look at what can be achieved in those first 4 years and what can be for 8 years. Because the reality is, as much as we may not like it, we need to get that political backing so our governor spends political capital in things that are doable and will have a generational impact in the population of the state that where we are at. That requires that it has to be investment in the infrastructure of health, of public health. What are the core capabilities of that department? Where is every single program coming to lay upon, so they can actually blend the funding, blend the actions, and multiply the impact? Because if you don't address the same structural problems that the agencies that are going to be acting on these big fancy ideas are, you are going to fail. You need a proper right infrastructure, properly connected with support from the community and other member in other organizations in the government, but the private sector as well. So you need to run a really good shop, an effective shop, a credible shop. And that means that you have to have really a good base and amazing infrastructure for data, for contracting, for moving people, for training people, for addressing things and being flexible. And on that base and on that core, you address the problems that you have on that population. And maybe, as I said in a previous answer, you address the things that are going to change this for generations to come. It may be that it is maternal mortality. It may be that it's children's mortality. It may be that it's adverse childhood events. Certainly, we look at what is getting the cost in the healthcare system. It's chronic conditions tied to obesity, like diabetes, cardiovascular, high blood pressures, cancers, many of which are tied as well to environmental factors. So you need to be able to paint a clearly comprehensive picture of where you can impact and who you need to have that impact. And you target those, building a good base that will be there after this time is gone.
Yeah, and what I agree, but first of all, with everything that everyone has said, and this is actually kind of fun to be able to paint on a canvas and there's nothing there. As John and Jose know, that our elected official, our county elected official, Judge Lina Hidalgo, came in with a very similar open slate and had her ideas, absolutely, but has been so incredibly receptive to public health and supportive of public health. And it's been incredible sea change in our community. So kudos to her, very similar to what Joneigh just said. But I would say a couple of things. One is that it's also about, it doesn't start on the actual the day you take office. It actually starts prior to that. And I think this is the political aspect of what we're all learning, right? And we've all seen, is that it's what did that governor run on? What did that governor actually campaign for? Is this even the governor that we are willing to be a part of? Because I think we need to really be very, very clear that it's not about what we public health officials will be doing. It is what we government elected officials, along with public health and all the other agencies, are going to be doing together. And we need to know that, because that's the political naivete that a lot of us in public health have taken, is that we're going to come in and we're going to change it all. But we can't do that unless we have that political will and we are working together as a governmental set of entities, and then also come in from what are those, as Jose said, what are those major drivers in that state? Obviously, we need to be thinking about families and children. We need to be thinking about the environment. We need to be thinking about not just the short game, but the long game. And the final question to the governor would be, are you willing to allow for that group of individuals to make those recommendations and support those changes if it's not going to be in that 4-year or 8-year cycle of return? That it's really the long game investment in the future. And you, the elected official, may not see that benefit to your portfolio or your bottom line, yet that's absolutely what's critical to the health of our communities across the state. And then the last thing I would say is I would love to have a all-star rock star team of the 5 or 6 folks that are on this call to be a part of it. Because I think we had that kind of a group and we would all be together, and it wouldn't be like one Secretary of Health or one public health director, but it was all of us together. We could just accomplish the moon.
If I could just add one additional thing to what Umair said and has been said by other, I think that we often talk about the art and science of medicine, but we don't talk about the art and science of public health. The art of public health is being able to present an investment that has long-term gains in a way that makes the short-term gains more apparent. Because, I think Umair, is right when he says that none of us can afford to be politically naive. We need to lose our public health knife and be more opportunistic about how it is that we advocate for our communities, how it is that we present ideas that have the greatest promise for reducing and eliminating racial inequities.
Thank you all. I think what you're highlighting is there are no easy answers. There's no simple thing. There are no quick fixes. These are issues that really take years of work and thoughtful reflection on policy and where to begin. We're getting a lot of questions, and so I have a suggestion. My suggestion is that we go through a number of the questions that are coming in from those who are listening, and maybe ask that we have 2 people answer each one of the questions, so we can go through quickly what those questions are, so you can compete among yourself as to which ones of you wants to answer these questions. There is a couple of questions that come in about how do we combat misinformation. There's been a lot of misinformation about COVID and about other issues. Another person links that kind of information to conspiracy theories that about a variety of different issues related to health, vaccine-related conspiracies, other kinds of conspiracies. So how do we deal with misinformation that is being spread in a variety of different ways, online and other ways, and particularly misinformation which can be harmful to the public? So 2 of you get to answer that. You decide who.
I want to be one of them, and I'll just say that one day I woke up and I had 100 new Twitter followers, and I was really excited, and turned out that I realized that most of them didn't like me. And that, I think, exemplifies this issue, which is really about we have to be engaged and active in social media and obviously all sorts of forms of media. But we also have to recognize that there's the yin and the yang. We have to be good at it, but we also have to understand the shortfalls of those mediums of communication, and we have to be willing to take on both. You can't just benefit from it. You have to be willing to take on the negative as well. And so I think that it dovetails into science and evidence, and shouting that from the mountaintop is one thing. And then obviously as scientists and public health practitioners, but to actually say that in a way that's going to be useful in the mediums that our communities are utilizing. that's a key message of how we should be addressing this.
I can jump in on this one as well. Drawing lessons from the measles epidemic that we had here in New York City last year, which was the largest in over 30 years, and then compounded by the misinformation around COVID. I think one is, as I mentioned at the beginning, being out in front, early, consistent, concise, approachable, accessible information about what the facts are and addressing misinformation head on. But I think and utilizing social media channels, as Umair alluded to, I think the other really critical factor that we learned from the measles outbreak that we've applied during COVID is engaging different communities as trusted messengers, right? Because I have to fully accept that as a government official, there are people who, by virtue of the fact that I'm a government official or had been a government official, aren't going to believe a word that I'm saying. But if I get their trusted leaders in their communities to be sharing my messages, to be using the channels that resonate most, either linguistically, culturally, what have you, then I have a better chance as a public health authority in a jurisdiction to ensure that we are maximizing the way in which we combat misinformation. I don't think we're ever going to get to a point where there's zero misinformation out there, but at least educate the public about where to go for trusted information that we see as partners.
Thank you for being so disciplined that I didn't have 5 people jumping in all at once. But if anybody feels like they have something strongly to say about that issue that didn't get said, going once. Okay, good. Another question has to do with financing, budget. We in general, public health funds have been, governmental public health funds have been decreasing. We've not recovered the losses that took place in the 2008 recession, for example, and tens of thousands of jobs have been lost. There's worry now, and some of you may be experiencing that with the hits to the economy that have resulted from the pandemic, the tax base is diminished, and that's going to result in layoffs and cutbacks at local and state health departments, maybe at the federal level too. So talk about the financing issues. How are you thinking about those? How critical are those to public health being able to address the issues that we've been talking about as the key ones?
We are all being too polite and who goes first. A couple of things. So enough money, no mission. So we as a society need to make sure what is what we want, decide on it, and fund it, correct? And historically, public health has not necessarily been abundantly funded. And as you mentioned, at the jurisdictional level, the health departments never recover from the recession, and clearly it's going to be an impact now. We need to start anticipating that. We know that it's going to happen. We need to figure out where we can have the biggest impact and which ones of our activities are going to really make a big difference. Some of us may say that we have already done that and that we just need the political commitment to fund those. There is data that says that maybe we are not where we need to be, and that's something that we will need at the federal level to discuss with Congress, at the state level with your state legislatures. But even though if we get more funded or the funds get decreased, we need to change the way that we operate. We need to blend the funding that we have. We need to stop thinking in categorical, siloed ways. It's my program, it's my activity, and this is the only thing that is important in my life. We as public health agents, in whatever level we are, need to be able to play with these others who are in the same place as us. Maybe we can multiply or leverage funding from other sectors. We have been trying to do this for years. In some places, we have been more successful than others. We have great partnerships with health insurance, and we know that if we work with the health industry, we can advance many areas. We know that if we work with the housing authorities, we can advance several other areas. If we work with the school sector, we work in many other. So we need, again, is going back to that intentionality. What is what we want? What are the best ways to get there and get toward that, knowing that we need to change our mindsets, knowing that a few things will have to give, but knowing that there are things that will give us bigger chance of success, and we need to look at that and implement those programs carefully. At the same time, we need to integrate many things. We cannot continue to be as categorical as we have been, and that may give us better opportunities. The issues that we were discussing earlier about messaging and communication and education, choosing the right partners to deliver those messages is going to be important, but as well is going to be choosing the right levers in the community to advocate for what needs to happen in the political process. Because at the end of the day, public health is part of government, and as such is subject to the political discussion. And we as a society pick and choose what type of government we set and what type of programs and actions that government is going to implement. We cannot separate one from the other.
John, I was going to say that I hope that with public health and the role that the public health departments and our public health workforce, it's been elevated. We are no longer invisible. And what I worry is that we don't take advantage of the moment to advocate for public health as being a public good in the way that people, that society invests in schools, in law enforcement, and other agencies at the local level. And I'm hoping that this changes the narrative in terms of the importance of public health as a governmental entity, whether it's the local or the state level. The other point that I would make, and this might be showing my bias in terms of my experience in governmental public health, are the challenges with which the way the funding flows. And it has largely, in my conversations with our public health colleagues, many of the local health departments haven't been able to benefit from the resources that are flowing through the state. There still remain some of the bigger cities like New York City, Philadelphia, LA, others, maybe half a dozen, who are in the same category as our state health departments. But then there's thousands of health departments. And so I really have been troubled seeing how difficult it has been for our non-big city health departments and our state health departments really struggle in terms of getting the resources that they need to purchase supplies for testing, that they weren't receiving adequate or appropriate supplies of PPE for standing up mobile testing sites. These are the sorts of things that I know we were getting many requests when I was working with Dr. Monroe and the team at CDC Foundation to fill those gaps. And so I think we have to figure out a different way of financing the public health entity so that the money does truly flow in a way that doesn't create these log jams or create these tensions that, in a time like this, we don't, in the local health department, we shouldn't be arguing with our state or our federal colleagues. It should be more coordinated in terms of the communication and also how the resources and the finances flow. And in the absence of that, what we're seeing are more well-resourced jurisdictions, larger cities, different communities where you have been able to lean and leverage other external funders, whether it's the private sector or philanthropy or those high net worth individuals that are out there. So I think this is going to be the harder nut to crack in terms of sustainable funding for the future.
So let me move to a different question, and one that I think people have grappled with. This has been a time when public health has had to grapple with political interference. And, you know, as someone who worked in public health for 30 years, politics has always been involved in the public health sector. There's always, you report to an elected official if you're a governmental agency. That elected official has other issues they have in mind. But I think it's not an exaggeration to say that the debate is very lively now about this. We've seen, the question of how do you insulate public health from the too much or inappropriate political interference, I think is clearly an issue that we're grappling with as a sector. Thoughts about that? How does public health retain its credibility by saying it's really focused on the science, not on politics, when the pressures are really heavy in terms of from political leaders? So anybody wants to answer those? Two people, please.
Let's not all jump at once on this one. I'll start it off to say, first and foremost, from my perspective, and this has been, I think we've seen it throughout the country, throughout the world. Public health is defined by the intersection of science and politics. And anybody who thinks otherwise has never walked in the shoes of a health officer, right? And so our job has been to work the politics in favor of where science is taking us. And, to the degree that we've been able to do that as a field, by and large, I think is a testament to the degree in which heretofore science has really led the way. I think that we are obviously in a new world, and one where science is taking it on the chin. I don't have a more articulate way of saying that. And I think that this is when governmental public health and non-governmental public health then need to work more closely together, because from my perspective, in these highly tenuous times, it's important for non-governmental public health to support those government public health officials that are protecting our communities. And, it's hard to do it from the inside. And to the degree that that aspect of public health can then support our government colleagues, I think makes the field that much stronger.
I think that transparency on science, data, and policy making is a key factor on this. Oxiris said it right. Public health, our work is at the interface of science and politics, because it's about the public, and the management of the public and decision of policy is in a democratic society done by elected officials. Having transparency in the way that decisions are made, incorporating different sectors in the decision-making process, is something that will facilitate an appropriate decision-making at the end of the day. The other thing is, it goes back to your first question, John, what keeps you grounded? And I try not to respond to the last second crisis. I keep the eyes on the prize. And we as a system need to be able to know where is what we're trying to go and what we are trying to achieve, and understand and accept that there are going to be bumps on the road. Regardless of where you come from, there are going to be bumps on the road. Having strong partnerships, having a tradition and a history of decision-making that is transparent allows that to be maintained. And we cannot drown on the crisis of the minute, because if not, we're going to lose sight of where we are trying to go. And that is, to me, what is most important. So trying to summarize what I just said is a participatory decision-making process that is transparent and where we as a public health sector acknowledge that we are not the only messenger and that maybe we need some other strong messengers in other sectors of the community that will advance that science message and help us build a better bed for our sector and a better outreach to the community.
And if I could just underscore what Jose said in terms of the importance of transparency, I think the greater the transparency in decision-making, the more sensitive the indicator is in terms of when politics is infringing on that decision-making. It just makes it that much more apparent.
Okay, so we're down to the last 7 minutes, so we're going to do speed round questions. We're going to ask you 2 questions. I'll tell you what they are. You each get to answer, and you have to answer really quickly, less than a minute each, probably 30 seconds. The first question would be, again, we're in an election year. There's a presidential election. I asked you about a governor before. The election is over. The president has been selected. You get a call from someone who's working on policy. They're asking you, what's the one thing you would recommend that's the key thing that would advance the health of the population? It's a quick answer. You can't talk too long. You just have to say what would you say? And to each of you.
I would say we need to quickly, day one, put out a national strategy on COVID-19 and rebuild trust in public health in the scientific community.
Thanks, Joneigh. Heathers?
I would say that we need a national health equity action plan that focuses on funding public health to the degree that it needs to target funding to communities that are facing the greatest inequities in health outcomes, and that questions why it is that we still have employer-based health insurance in light of the fact that because of COVID, millions of Americans have lost their jobs and as a result have no longer access to health insurance.
I would say we need to support and elevate federal agencies like the CDC to the status that it has always had prior, and that we should make sure that that is also coordinated with state and local public health agencies also having that type of investment in them, because the undervaluation of public health cannot happen any longer under a new administration.
I would recommend what I think the party line is recommending, which is this infusion in public health infrastructure. So looking at the funding that's really required. So I think the latest was $4.5 billion for public health infrastructure, and making sure that we don't perpetuate the fragmented funding structure of the past and really use it as an opportunity to build it in the way that we want to, so that it is better coordinated in terms of how those fundings distributed to strengthen governmental public health at all levels.
I will go with two components. One, I will figure out how we can build, rebuild, improve, upgrade our public health infrastructure, making sure that we address core capabilities and functionalities that give us greater standards for quality in which we can implement programs. But we will implement programs that are integrated with blended funding as part of a national strategy that will address key issues in health through the lens of social determinants of health. We are not going to solve the health issues if we only look at them from a medical perspective. We need to have an integrated strategy for that.
Thank you. That's a great comment. So the last question I'd say is, we've talked about a number of things, but public health has so many different components. We've left some things out. So I want to give each of you a minute or two to just say, what would you say we haven't touched on that you really think is a key issue that needs to be front and center as we think about the future of public health? And, we only have a little less than a minute for each of you.
I think the one thing I would underscore is that, and whether it's at a federal, state, local level, whether it's, global level, is just really elevating public health to a level of health and wellness, and really having it to that level of importance at the governmental agency level. So if it's a president, it's at a cabinet level. If it's at a state, it's at a secretary level, and it's not diminished under another sector. And then certainly at a local public health, a local government level, that it's actually also at that level of importance.
What I would add is that that we haven't touched on to the degree that I think is needed is ensuring that in the post-COVID rebuild of our country, in addition to addressing the underlying social determinants of health, housing, education, et cetera, that we have front and center the mental health needs of our country. I think that the trauma that we have all suffered, both acutely as well as long-term, are ones that we will need to have structured approaches to. And, it was touched on earlier in terms of the impact to children, but certainly the impact to adults and through the life course is going to be something that will have consequences for generations to come, and can really influence the degree to which we as a country come together in support of one another, or continue to have a Darwinian approach to the way in which we foster health and wellness in our country.
Thank you so much. We have just a minute left, but we want to hear from the others who haven't had a chance.
I just say quickly.
Sorry.
Go ahead, Jenny. Thank you, Monica. I think we really need to not let this crisis go to waste and really build upon partnerships outside of public health. I always say that work with public health is not just the public health department, but we need to be strategically engaging our businesses, our education sectors, our hospitals in an intentional way, so that when the next pandemic comes, and I believe it will, we are prepared and we're not playing catch up. So I think those strategic partnerships are really important.
Thanks, Joneigh. Monica.
Just building off of what Joneigh said, we touched on it in terms of community engagement, but I definitely think as we think ahead, how do we build on the strengths and the assets in community to help communities be resilient during this time? And that intersects with what Oxiris was saying in terms of, how do you layer on to the work that the health departments are doing so that it is trauma informed and takes into consideration all of the trauma and health inequities that our communities of color have been confronting for decades.
Jose, you have the last word.
I think that after this, as a nation, we're going to have what is equivalent to a post-traumatic societal stress disorder. And we need to figure out that from an integrated perspective, what are we going to do about it? Because it's not just having more therapists for the people who is requiring those today. We continue to see an increase in opioids. That is another epidemic that has not ceased because we have a pandemic. We have all of the other things happening, and we need to get back to those and address what the pandemic uncovers and what the pandemic increase. And as a society, we are going to be hesitant to do many things. But at the same time, we need to realize that we learn, and that we learn that we're on this together, that if I am infectious and I don't do what I need to do, I'm going to infect people. And because of me, we're going to close my school. We need to be able to, as a society, capitalize on that and move it to address, and as a society, respond and support those of us who are going to be way more in deep and in need after this that we were as we had started.
Well, Thank you. A wonderful panel. We're so fortunate to have you not only participate in this panel, but more importantly, to be such remarkable leaders in the public health field. Thank you very much for your insights and your thoughts. To those of you who are participating and sending questions, thank you for those as well. This will be an ongoing discussion, but I think we've laid a nice groundwork for thinking about where we are now and where we need to be in the future. So thank you all for participating.